Good afternoon, folks. This afternoon's topic A is how conditions change your brain. So we're going to go through that today for the presentation for A. So please join me in today's presentation A. Here we go. The phrase how conditions change our brain refers to the impact various medical and psychological conditions have on brain structure and function. Based on the surrounding page content, different conditions can alter brain activity, shrink or damage brain regions, and affect cognitive abilities. For example, PTSD can make the amygdala overactive, reduce activity in prefrontal cortex, and shrink the hippocampus, which is responsible for memory. Okay, depression can decrease activity in the prefrontal lobes, leading to reasoning and judgment issues. Long-term depression may also cause brain inflammation, increasing the risk of memory problems and dementia. Okay, give me 1 second, guys. Second page. Stroke results in permanent brain damage, with symptoms varying based on which side of the brain is affected. Okay, then there's alcohol use disorder. Can shrink brain regions, particularly the hippocampus, which is crucial for learning and memory. Then there's schizophrenia, leads to loss of gray and white matter, affecting information processing. Then there's Alzheimer's disease, disrupts communication between neurons due to protein buildup, leading to cognitive decline. Then you have migraines, involve nerve overreaction to triggers, which can lead to loss of gray matter and white matter over time. Give me 1 minute. Okay, then there's concussions. You know, when like football players go and butt heads, that causes concussions. Okay, then these concussions cause bruising and inflammation in the brain, potentially leading to long-term damage if repeated. Okay, then you have bipolar disorders linked to neurotransmitter imbalances that affect mood regulation. Okay, then there's MS. MS, damaged nerve, insulation, disrupting information flow and causing neurological symptoms. And then there's ADHD is associated with differences in brain structure and function, particularly in attention related networks. Okay, then there's meditation has been shown to increase gray matter and strengthen connections between brain cells, potentially reducing inflammation and protecting against Alzheimer's. And then you've got exercise boosts blood flow to the brain, promoting cell health and growth. These examples illustrate how various conditions, both harmful and beneficial, can shape the brain over time. Then here's your question. Here's question 1 for y'all. Would you like more details on any specific condition? Okay, then I've got some more for you. Then explains all the conditions we've got going on. All right, so here we go. PTSD, post-traumatic stress disorder, causes significant changes in the brain function, particularly in three key areas: amygdala, fear response center. This part of the brain becomes hypersensitive, meaning it reacts more strongly to perceived threats. This can lead to heightened fear responses, anxiety, and difficulty distinguishing between real danger and safe situations. Prefrontal cortex, regional thinking, and emotional regulation. PTSD reduces activity in this area, making it harder to regulate emotions and suppress fear responses. This is why people with PTSD may struggle with impulsive emotional outbursts or difficulty calming down after stress. Hippocampus, memory and learning center. PTSD shrinks the hippocampus, which is responsible for distinguishing past trauma from present reality. This can lead to flashbacks, intensive memories, and difficulty processing new information. Essentially, PTSD keeps the brain in survival mode, making it difficult to relax or feel safe over time. These changes can impact daily life, relationships, and overall mental health. However, treatments like therapy, mindfulness, and meditation can help rewire the brain and restore brain. Hold on. Different treatments for PTSD can help rewire the brain and restore balance by reducing hyperactivity in the amygdala, strengthening the prefrontal cortex, and promoting hippocampal growth. Here's how some key treatments work. Cognitive behavioral therapy, or CBT, helps retain thought patterns, reducing fear responses, and improving emotional regulation. Okay, then you have down from that, you've got eye movement, desensitization, and reprocessing, which is EMDR. Uses guided eye movement to help the brain process traumatic memories more effectively. Prolonged exposure therapy. Gradually exposes individuals to trauma related triggers in a controlled way, reducing fear responses over time. Okay, then there's meditation. SSIRS, SNRIS, antidepressants like sertraline and paradoxin help regulate neurotransmitters, improving mood and reducing anxiety. Mindfulness and meditation strengthens the prefrontal cortex and increases hippocampal volume, improving emotional control and memory. Exercise boosts blood flow to the brain, promoting neuroplasticity and reducing stress hormone levels. Art therapy and positive experiences. Engaging in creative activities or learning new skills can help form new neural connections and reduce PTSD symptoms. These treatments work by retraining the brain to respond differently to trauma, helping individuals regain control over their emotions. Last page, guys. And reactions. Would you like to explore a specific therapy in more detail? Like I said, folks, the questions are open-ended, so you can answer them. So we could see if we need to do a show, another show on topic or not. So, with that being said, the question is, would you like to explore a specific therapy in more detail? So I'm going to leave that one open for you, and leave me your comments or questions at the in the chat section, in the chat for me to answer. So for now, Gator Wellness, take care, folks.